Next guest speaker that we have is coming from somewhere in Australia. I do apologise, Fiona. No one seems to have a definitive answer. You're potentially anywhere from Brisbane, Sydney or Adelaide, somewhere in South Australia potentially. We're not really sure, but we can see you, so we do know that you're here. So that's a good start. So Fiona is representing Dementia Support Australia, is partnering to support young people living with a dementia diagnosis. Dementia Support Australia, a national service that is locally based and provides tailored personal advice to carers of people with dementia, where behaviours may be impacting negatively on the carer and or the person with dementia. This presentation by Fiona today will provide a brief overview of the work with the dementia consultants have done with families with a child with dementia, how to access service and what support is available. And there will be a case study that will be discussed as well. Welcome to us, Fiona, today, and I will let you introduce where you are and what you're doing.
Hi everyone, thank you for having me. I hope you can hear me all right. I'm based in Sydney, but I do travel around a bit. So as you said, we are a national service. So I hope you can all see the slides there. So thanks for the introduction. I am going to be giving you an overview of what support Dementia Support Australia provide to young families, to families with a young person living with dementia. I haven't given one of these presentations before, and I just wanted to warn you that I am on the tail end of COVID. So if I mute myself, I may just be coughing. Some of you may be able to empathise with that. All right. All right. I just wanted to give you some background as to how this all came about. Some of our team attended a conference and they overheard some parents talking at the conference and felt that our organisation might be able to help, and you'll hear this several times through my presentation, by providing a bit of a dementia lens as to assisting with some of the behaviours that families were going through with children with dementia. So listening to the parents, we realised we may be able to help improve understanding and give support to those families. So along with Dr. Inika Whiteman, DSA formed a partnership with Batten's Disease Support and Research Association Australia, and a small group of consultants that undertook some training and education, and they volunteered to form a group to help support the families. Obviously, we're very much used to working with older people with dementia. We do see people with younger onset dementia, and sometimes they can range from 30 plus, but we weren't so familiar with dealing with the small group of young people living with dementia in Australia. So we formed a partnership, and we're also doing some work with the Childhood Dementia Initiative. And I must pay homage to Heidi Dowse, who's since left the organisation, but she was pivotal in starting this process. So who are we and what do we do? As you've said, we're a national-based service, so we cover the whole entire country. We have offices in all of the major capital cities, and we also have small regional offices. We were started about 7 years ago when the government realised that more expert advice needed to be provided in that complex dementia space, as unfortunately our population ages and dementia becomes more prevalent. We needed people who were more expert in providing support and advice to carers of people living with dementia, both in the community setting and in residential aged care. We provide tailored and personal advice. We do it on an individual basis. We provide reports and strategies after usually an on-site assessment where possible. We also provide support over our phone line, which runs 24 hours a day and is staffed by consultants. Our staff are accredited clinical experts with usually a clinical background of something like nursing, speech therapists, occupational therapists. Our aim is also to build the sector capacity, so to pass on the strategies and knowledge that we have to empower carers to feel better supported to manage where behaviours are impacting on the well-being of the person. We also build industry partnerships, as we have done in this space. So how does it work? We provide a holistic assessment. So we visit with the family and the person with dementia, and I'll talk about that as far as our cases with the young people go. We've mainly done on-site visits with families in either the care setting or the home, with either perhaps some NDIS carers and the family, or we've done a bit of both. We've done telephone support and we've provided email strategies where that's more appropriate or that's what the family felt would be helpful. I understand with some of these families there's a lot of services coming in and out of the home, and sometimes that can be very overwhelming. Our aim is to identify what might be causing the behaviour. And when I'm talking about behaviours, I'm talking about things like agitation or sleep disturbances. We try and identify the contributing biopsychosocial and environmental factors that might be involved there. And in partnership with the families and carers, we provide support and advice to assist with reducing the distress for the young person living with dementia. We formulate a comprehensive behaviour management plan and provide this to the family and, if appropriate, the care team. We support this with ongoing implementation. So we do follow-up. We're a short-term case management system. So we might support over several months with follow-up, revisit, calling, to perhaps tweak the strategies to see if other things might work. We monitor the behaviours and the implementation of the plan until we feel that the distress is adequately managed. We also have the ability to broker items that might be of benefit to reduce behaviours. So we have funding for that. An example of that is what we've done with several families is broker some headphones for the young person, and we can load those with music to provide some quiet time, for example. We also have access to things like sensory items such as soothing blankets or textured balls or materials, and robotic dogs and cats. As I've said, our consultants are experienced health professionals who come from a range of backgrounds, which is very beneficial when we're working within the team, because we can support each other to have a slightly different perspective. Some of our consultants have experience with the NDIS space, and there are various professions there that can be very helpful when we're looking at different behaviours. The reason the glasses are there is, as I've said, we provide a dementia lens over the care and support that we can give the families, which perhaps we found families don't have as much understanding because, of course, it's not talked about in this space, what dementia actually might mean for some of the day-to-day activities and impact on the families and the young person. Just some data from the referrals that we've seen in the time. So I think we've been up and running for around 18 months. Our youngest child has been 2 and our oldest young adult 27. The diagnosis group we've supported is a range of the Batten's disease, Sanfilippo, Lafora, Niemann-Pick's and various mitochondrial diseases. And some of the reasons we've had for referrals include vocalisation where it's having an impact on the rest of the family, or there's no underlying reason that can be detected for the distress, such as yelling and screaming at certain times. And I'll talk about that in the case study. Anxiety, where it really impacts on their well-being, agitation, and sleep disturbances. Some of the reasons for the behaviour that we've identified are pain, overstimulation or sensory overload, also common in our adult population with dementia. That can be a contributing factor for behaviours as well, and things that are going on in their environment. As we know, many of these young people are living in a family environment where the rest of the family also needs to function. So sometimes the noise and different times of the day can mean that overstimulation or sensory overload for some of these children. That's what we've found anyway. I wanted to discuss a case study we've seen, and this young girl's name was Maria. She was referred to Dementia Support Australia as her carers reported that at least once a week she would be awake for at least 24 hours straight. She would yell and scream at people, family and carers when they tried to engage with her, and everything that had been tried wasn't working. So the consultant went to see Maria at her home and chatted with her carers and Maria about the situation. It was reported that Maria would return from an outing with her NDIS support worker around 4 p.m. once a week. Her carers reported on this day each week that was usually the day where they struggled to get her to sleep at night. The DSA consultant was on site and observed that when Maria would come home from the outing, she was happy and excited, but the carers also wanted to engage with her and ask her about her day. This seemed to increase her distress when asked frequently about her day, and she would start to walk around her home anxiously. The consultant suggested that when Maria returns home from the outing, the carer encourages Maria to spend time in a quiet place with some gentle music playing with her favourite blanket. She was holding that. The carers were encouraged to leave her for up to 30 minutes to calm herself and readjust being at home. They also encouraged not to ask her about her day, but rather get the information about the day from her support worker in a sort of handover. They could then use this information later on to chat with Maria when she was in a more settled state. The carers trialled the suggestions for 1 month. The consultant regularly contacted and checked in with them to see how things were going and if any additional strategies were required. After 1 month, the carers reported that Maria was sleeping much better after her weekly outings. They had adjusted their approach and left Maria for up to 1 hour to readjust to the home environment. Sometimes they just sat with her and listened to her favourite music and consistently did not ask her about her day or overwhelm her further. How do you contact DSA? There are several ways. You don't need a referral from a doctor. There's no cost to the service. It would not impact on any plans or funding. We have 3 ways. We have a website, and on that website is the Childhood Dementia Support page for further information. And also on the website, there's a Refer Now click button, which you can use, or a live chat function. Our 1800 line is staffed 24 hours a day by dementia consultants. So some short-term or initial strategies might be able to be offered over the phone, and then that consultant would send through the request to one of the team, and it will be allocated to one of the team to follow up on the phone and see how we can help. Are there any questions? Sorry, I can't hear you. Oh, I still can't hear you.
I have a battery issue, but I'm sure it will be resolved.
That's better. I thought it might have been on my end. That's okay.
No, you're fine. I will probably cut in and out because it's telling me that's a low battery. So questions. We do have time for questions. If there is anyone that has any questions on this one, yeah.
Do you think it's similar to Niemann-Pick? Because I can't sleep. I go for hours, days without sleeping.
Yeah, so the sleep...
Oh.
all the information is in the book. Yeah. Yeah.
We live in Sydney, and I've got name and pick, and, you know, it's very difficult.
Yeah, so Mandy can put you in touch. So if anyone does want to get in touch with Fiona, either Dee or Mandy can certainly help you out and get you across there. Fiona, is there anything that you've noticed? I mean, obviously you can't disclose personal details, but you've mentioned that you have. Is there a person with Neiman Pick that that has been supported in the past, or?
There is. I haven't personally, but one of the team have.
Yep. Are there any differences, I guess, to services, or is there any? Is it an atypical service that you've described with your case study? Is that what this person also found?
That scenario has been quite common amongst, but obviously, what it is very much an individual assessment and recommendation, because every situation, social situation and person is different. That we found there is a saying in the dementia world that says when you've met one person with dementia, you've met one person with dementia. It's a very individual condition. So, but we do tend to find themes around overstimulation because we have found, of course, that children and young people are having a lot of therapies, and that can be very overwhelming as their cognition declines. And that is a theme that resounds in the older population as well. Noises, things that we don't notice can be very overwhelming for them. So we have found that, but I would never generalise, but we do find that can happen.
I think also
Does
for
that
the
answer
families,
that question?
Yeah. I think also for the families' points of view, Fiona, the dementia support people that you're talking about can also help with assessments and report writing and contribution to the NDIS plans and management of the team that's providing care.
What we can do is provide you with emailed strategies and reports. We don't write behaviour support plans as such.
No, not a BSP,
We
but
don't.
documentation about dementia itself, supporting it for younger people. Yeah.
Yes, in a limited capacity, we can provide a report of what we've done and what we've seen, but we don't work in the clinician medical space. We work in the psychosocial space, if that makes sense.
And I think it's a good strategy. I know from my experience working with Mandy's boys, to get, particularly with her NDIS funding, we had to take a component of comparing where one of the boys was at to if he had dementia, he would be at stage this. So that allows someone who's not familiar with your condition or what they're dealing with to actually be able to assign it to a particular thing and go, oh, I know dementia, that's where they're at. I can now figure out how to fund for that. So it's not so much dismissing where you're at, but it's gaining a like or a similar understanding in the people that you're reporting to. So that's something that I've found as well as when doing the reporting. So the dementia information can be quite handy when you're looking at the likes of your NDIS plans or getting other people to understand where you're at. Any other questions for Fiona? No? Excellent. So as we've said, there is information in our booklets. You can contact Mandy or Dee if you do want to get in contact with Fiona or Dementia Support directly. Thank you so much for your time today. Absolutely appreciate
Pleasure.
it.
I think I'm seeing you later in the workshop.
Oh, fantastic. You're joining us later. Yep. So
Yeah,
there you go. If you do have any questions.
Yeah, that's right. If anyone thinks of anything they might want to discuss with me, no problem. But yes, the 1-800 number is the number to call for further information and have a look on our website. Thank you, everyone. Thanks for the opportunity to present.
Thank you so much. Appreciate your time
Bye.
today.